So to kind of sum a lot of this up, and like I mentioned at the beginning, I don't claim to have any answers. I mean, my whole goal in being here is to field some difficult questions from you guys, and to kind of, hopefully, you'll leave here and you'll be thinking about this issue a little more, and about the connection between agriculture and our health. That said, I do think there are a couple things that we can and should do. The first is that we should continue strengthening school nutrition and school lunch programs. Just last month, we made some of the most probably encouraging strides in 15 years or so, where now school lunches are actually getting a small increase in funding, and they're also cutting out a lot of saturated fats and trans fats and increasing the amounts of fruits and vegetables that are going to school lunches. And this is good, but to really take advantage of the momentum, this needs to be tied with some sort of educational component, where we're actually teaching kids from a very young age that we need to pay attention to the foods we're putting in our body. Looking around, a lot of you guys probably won't even recognize this, but this is the new food pyramid, and the food pyramid is great when you think about it, because intuitively it shows you that there are some foods you should eat more of and some foods you should eat less of. That's what at least the food pyramid I grew up with. This one doesn't do it. So this is what our kids are kind of looking at now. So, no wonder that there's a little more confusion around, well, the marketing around is great. So that's one area. Another area that I think that we should focus on, and this is admittedly a little more controversial, would be requiring food stamp recipients on the SNAP program, which is Supplemental Nutrition Assistance Program, to use a portion of their benefit to buy healthy food. When I was working on this book, I spoke with Brian Riedel about this, and he said, no. I do not want a government regulator stepping in and saying there are some foods that I can eat and some foods I can't eat, and there are some foods that are healthy and unhealthy, because that will become so politicized that the recommendations will end up being meaningless. And I think he's right that there's going to be a big challenge in implementing this in any kind of way that will yield the outcomes that we need. But at the same time, when you look at the impact of dietary disease, this isn't something that falls evenly on all sections and segments of society. The poor and the minority and the disenfranchised groups are far more likely to be obese and diabetic. And when you look at the economic mobility constraints here, if they, and the fact that we really are starting to perpetuate some sort of cycle of poverty, if we aren't caring for the health of these people, then we're just kind of enabling a permanent underclass of citizens who are unable and unhealthy to be able to become contributing members of society. Another challenge here, and this goes back to the economics behind it, is that if you look at the 40 million Americans on food stamps, the number is astonishing, about 2/3 of them live in urban centers. Now, the percentage actually used to be quite a bit higher, but 2/3 is still a lot. Urban centers are also sometimes referred to as having food deserts, meaning that even if these people want to buy healthy foods, they're unable to. Oftentimes, because if you're buying your groceries at a little corner store in Detroit or Newark or wherever, odds are you aren't going to have the same availability that we have at a Whole Foods or a Giant or a Trader Joe's or Safeway or whatever else. By requiring a percentage of this benefit to be used to buy healthy foods, I don't care if that's a fresh fruit or vegetable or frozen or canned, it doesn't really matter. But by requiring a portion of that benefit to be used for this, you're going to automatically build in a certain level of demand in the marketplace. You'd expect the market to respond by having more availability of these foods in these areas. So, next recommendation, and this also is going to be somewhat controversial, is tax bad products, tax unhealthy products. We already do this. Look at this cigarette, the tobacco and alcohol taxes. Going back to the high fructose corn syrup and these beverages and whatnot, if you look at the numbers here, each American consumes somewhere around about 440 cans of soda a year. Putting a 1 cent tax on each one of those cans will yield the government about $1.5 billion in revenue. And if that's revenue that's then used to help balance budget, or to help, my preference would be to help fund an educational campaign, encouraging people to make healthy decisions, then I think that's money well spent. And we know it works. The next recommendation is probably the most difficult, and this is the one that, I know something needs to be done, but I don't know what. And that is that we have no accountability in our healthcare system. It's one of those things where if I suffer from dietary disease, and again, 80% of cases of diabetes are preventable through diet and exercise, but if I get one of these diseases, I'm not paying for it. It's a cost that's ends up burdening society as opposed to me. And so when we look at healthcare reform and all of the imperatives here, there has to be some degree of accountability built in so that I'm responsible for my own healthcare outcomes. And again, this is going to be really difficult, but we need it. And really the last recommendation, and this is really the thread that ties everything else together, it's the whole reason that I'm here now, is education. I think the more we know, the better decisions we're going to be able to make. And when it comes down to accountability, just making good choices, that's what I'm hoping this information will arm you to do. So with that, I want to thank you guys again for having me here, and I'd like to open up the floor for your questions.
Very good.
Thank you.
How do you know that education